Welcome, welcome, welcome. My name is Ron Getzel. Delighted to have you join us today for this webinar on the Innovation Award winners from the University of Michigan. They're going to be talking about their programs, some challenges, best practices, and we'll have a robust discussion with them. We're going to have a Q&A session, and in the session, we'd like you to throw in your questions into the Q&A button on the screen. So don't send it into the comments problem or any of that discussion chat or all that. If you have a question, please write it in the Q&A and we'll get to it. With me today, David Ballard is running the show. He's the chairman of the board for the Health Project, and also Rebecca Kelly's past chair of the board for the Health Project. And I'm the president and CEO of the company, the organization. It's not a company, it's a nonprofit. Remember that. We are delighted to have you here. And before we start our program, I wanted to let you know that we are traditionally known as the Coop Award. So we've been around for over 30 years, receiving applications and reviewing those applications and honoring winners of the C. Everett Koop Award, who was a Surgeon General for the 1980s during Ronald Reagan's administration, who started the Health Project back in the early 1990s. This year we've done something a little bit different. We introduced something called the Innovation Award. And let me see if I can get the screen to move. There we go. We know that there are a lot of organizations out there, private and public, nonprofits, who are doing some really creative work. And they're moving beyond the very traditional model of workplace health promotion into different areas, many different areas. And the kinds of innovations that they're introducing are worthy of documenting and recognizing as best practices. Here's some examples of innovations that we were looking for. Engaging hard-to-reach populations, and I think that's the main theme of today's presentation with the University of Michigan. Organizational change initiatives focused on culture, difficult challenges such as pandemics that we have gone through, new approaches and models to health-related behavior change, addressing health equity, use of technology, and focusing on broader environmental, social, and economic factors beyond the four walls of the company, the organization. And so today, we have our winner of this year's 2025 Innovation Award, the University of Michigan, and to talk about what their program is all about, and to get into a dialogue, a conversation about what they experienced and how they dealt with that. I'd like to introduce our three speakers, Allison Nix, Bree Carpenter, and Karen Schmidt, who will walk you through what it is that they've done. And I think we're going to start with Karen. So let me stop my screen and open it up and welcome you, Karen, to this webinar.
Well, good morning, Ron, and good morning, everyone. On behalf of Bree and Allison and myself, we are just thrilled to be here. Again, my name is Karen Schmidt. I'm the Senior Director for mHealthy, and we're excited to share our story today. Before we begin, I would like to thank the Health Project for this award. We are honored and grateful to have received the award. And I'd be remiss, y'all, if I didn't acknowledge our social determinants of health and resource coach team and many partners for their passion and commitment to the well-being of our community. We couldn't have received this award without their vision, creativity, and tireless contributions. Before we dive into the Social Determinants of Health and Resource Coach program, I wanted to give you a quick overview of the university by the numbers. We have about 55,000 active employees. We cover about 123,000 covered lives through our benefits. We have 13,000 retirees and over 65,000 undergraduate and graduate students. This includes 3 academic campuses and our academic medical center. Because of our size, we have a tremendous opportunity to positively impact the health and well-being of our community. And with this opportunity also comes some unique challenges in supporting the diverse interests and needs of faculty and staff, while also ensuring our programs and services are inclusive and accessible to all. I wanted to share a high-level overview of well-being across the university. And we are extremely fortunate that well-being is woven throughout the university's culture. We've worked hard with many partners, frankly, over a number of decades now, to create a supportive environment where all can flourish. And we're incredibly grateful that well-being is embraced and continues to have strong leadership support. And we've also been very intentional that the work and the focus of mHealthy is connected to and aligned with larger university priorities and initiatives. The pictures on this slide help to illustrate that. The colorful petal diagram on the left-hand side is our model of well-being, and we developed this in partnership with our student life colleagues, and it highlights 8 different domains of well-being. And this model helps to guide our strategies and ensure we're taking a holistic approach to well-being and meeting folks where they are and how they want to engage. The upper right-hand picture illustrates our alignment and support of the Okanagan Charter. In September of 2021, the university joined 7 other U.S. universities in adopting the Okanagan Charter, pledging our commitment to take a holistic and sustainable approach to becoming a health promoting university. And finally, on the lower right, the picture of Look to Michigan. It's an initiative that outlines the university's 10-year strategic plan that began just last year in 2024. This is really our North Star, and it will be guiding us over the next 10 years. And we're super excited, y'all, that one of the impact areas within this 10-year strategic plan focuses on human health and well-being. And specifically, there are a number of points of impact within this focus area that are aligned very closely with mHealthy and our social determinants of health and resource coach program. One of those areas is to promote a vibrant and health conscious campus culture by integrating well-being into every facet of the university experience, comprehensively addressing the mental, physical, and emotional well-being of our community. And secondly, closing the health equity gap by directing research and clinical breakthroughs towards the needs of the underserved, making a lasting and positive difference in the lives of those most in need. With that, I'll turn things over to Allison to share background on our Social Determinants of Health and Resource Coach program. Allison?
Thanks, Karen. Good morning, everyone. So mHealthy has offered behavior change programs for many years. But in the last few years, we've expanded our focus to address basic needs more directly. One of the first initiatives mHealthy supported in the social determinants of health space was the establishment of a living wage policy at the university, ensuring a minimum wage of $15 per hour for all employees. That was an important first step toward economic stability and equity. In 2019, we began thinking more intentionally about how we could further contribute to health equity across our population, starting with the essentials: food, housing, and transportation. That same year, we launched our first food sharing cupboard in logistics and support services, which was actually an idea that came from our mHealthy champions. What started as one cupboard has now grown into 10 cupboards across the health system. Then in February of 2020, we took another big step in the launch of the Resource Coach program, which Bree Carpenter will share more about in the next slide. We received official presidential approval, from then President Mark Schlissel in 2021, which really solidified this work as a core part of mHealthy's mission. And as with any large and meaningful effort, this work happens through partnership with poverty solutions, mental and emotional health programs at the university, leadership at Michigan Medicine and University Human Resources, the mHealthy Advisory Committee, our benefits office, and the University of Michigan Credit Union, just to name a few. Together, these collaborations have helped us build a stronger foundation for supporting our workforce and advancing health equity across the university. And now I'll hand it over to Bree.
Hello, everyone. I'm so glad to be here with all of you. I'm Bree Carpenter, Social Determinants of Health Program Manager. So I will start with sharing about some of our what we're doing with our current SDOH initiative. So the University of Michigan Social Determinants of Health initiative has continued to expand in both reach and impact. Allison gave us some info on how it got started, and I'll give you some info about where we're at and where we're going. With coordinated efforts, we're able to target the most common barriers to employee well-being. Our approach centers on three main work groups: the financial well-being work group, food and nutrition security, and of course, our resource coach program. All of these programs and work groups are designed to address structural factors that influence health, stability, and employee engagement. Through the financial well-being work group, we're able to connect employees with practical tools to help build their financial confidence and reduce stress. This past August, we hosted our second annual financial resource fair directly inside of the Michigan Medicine Hospital. This allowed us to meet employees right where they work. The fair drew 171 attendees across shifts and roles and offered direct access to financial counselors, community partners, and, of course, our resource coaches. In addition, we offer virtual financial workshops nearly every month covering topics like home buying, saving for college, and navigating credit. In partnership with the University of Michigan Credit Union and other financial partners, we're so excited to continue offering these workshops. The sessions make financial education accessible across our multi-campus workforce, including employees who may not be able to attend such workshops in person. They're offered at noon during the workday to offer employees the opportunity to lunch and learn. Our food security or food nutrition and security work group has also been expanding access to healthy and affordable food. One initiative we're especially proud of is the food sharing cupboards located in the employee break rooms across the hospital, primarily those that employ wage band 1 employees. These cupboards are stocked regularly by one of our Healthy Wellness coordinators and allow employees, especially those working on overnight or continuous shifts, to grab nutritious snacks directly in their workspace. No forms, no barriers, no questions asked. During Hunger Action Month this year, we saw incredible cross-campus collaboration. Our wellness champions and coordinators, Healthy and the Mesa Blue Cupboard, partnered on a coordinated food drive that collected 3,464 pounds of food to support those experiencing food insecurity across our multi-campus community. And central to it all, as we're here to talk about today, is the Resource Coach program, which has expanded recently with the launch of our Basic Needs Resource Hub pilot. This is an office located directly inside of the Michigan Medicine Hospital. Because over 70% of Resource Coach clients or participants work within Michigan Medicine, this pilot was a natural and important next step to continue meeting employees where they're at. The hub allows our coaches to offer in-person support in the same space where many of our employees spend their day, helping with needs that are best met face-to-face, such as accessing emergency food, completing forms, or simply connecting in a more personal face-to-face way. While we're still in the early stages of data collection, the feedback and early results tell us that we're absolutely heading in the right direction. We're improving access, strengthening relationships, and reinforcing our commitment to meeting employees where they are, both literally and figuratively. Next slide, please. Thank you. All right, so here we are. At the heart of our social determinants of health work is the Resource Coach program. This is a person-centered model that recognizes income as a critical determinant of health. The program itself was designed to close the gap between knowing help exists and actually being able to use or access it. Because for many employees, it's not a lack of motivation, it's the complexity of navigating systems while managing work, family, and financial stress. Our coaches provide confidential case management services and connect employees to internal supports like Healthy programs, financial counseling, and so on, as well as community-based resources such as rental assistance, transportation support, or legal aid. When immediate relief is needed, coaches can also provide direct financial assistance for eligible applicants through our mini grant program and our emergency hardship program. These funds have helped employees cover utility shutoffs, repair vehicles needed for work, or secure or maintain their housing. But just as importantly, they provide emotional relief. Having someone to call, someone who will walk by you through the process, can make the difference between spiraling and stabilizing. What makes this model unique is that it doesn't stop at crisis resolution. Coaches also work with employees on long-term strategies, budgeting, goal setting, and connecting to skill building opportunities. In other words, our resource coaches help turn a moment of crisis into a moment of momentum. Next slide. Alrighty. Our most recent data from the program highlights the tangible impact of our work. In 2024, more than 300 employees engaged with a resource coach. Across those interactions, we made 846 referrals to resources, awarded 207 mini grants, and distributed 33 emergency hardship program grants. The top areas of need that were highlighted there were help with utilities, transportation, and housing stability, all of these reflecting essential life factors that when disrupted can cascade into health, financial, and workplace challenges. The outcomes are powerful. Allison will talk more about those in an upcoming slide. Beyond satisfaction, we're starting to see deeper shifts in our preliminary data, and she will talk more about that as well. The findings that we're seeing reinforce what we've always known. When you support the whole person, you strengthen the entire system. The Resource Coach program is proving that with upstream investment in social determinants of health, we pay dividends in downstream health and productivity and retention. With that, I will hand it over to Allison.
Thanks, Bree. So as Bree mentioned, we've seen a lot of success with the program since its 2019 inception. In a participant survey provided to Resource Coach clients, 90% agreed or somewhat agreed that they were able to lessen the impact of an unmet critical need because of their involvement in our program. Additionally, 93% of Resource Coach clients reported they were satisfied or extremely satisfied in the support they received from our resource coaches. This graph shows emergency room participation over time among Resource Coach program participants compared to the general employee population. At the start, you can see there's a clear gap. Participants in the Resource Coach program are more likely to be in salary band 1, which often means they're individuals with higher emergency room costs. That's not surprising given that financial instability and unmet basic needs can directly affect health outcomes and healthcare utilization. But what's encouraging is the change we're seeing over time. Even though this particular graph focuses on participation, related data shows that our 2022 Resource Coach program participants' ER costs started off higher than the general employee population, again, reflecting that salary band group, one group. However, as the years go on, even while ER costs for the general population are increasing, the participant costs are actually coming down. So what we're seeing is not just engagement, but real evidence that addressing basic needs and financial stability may be contributing to better health outcomes and reduced ER utilization. So there are a few things that we've learned that really make a difference when it comes to moving this work forward. And first, it's leadership buy-in. When our senior leaders visibly support this work by talking about it, showing up, and allocating resources, people notice. That kind of commitment sets the tone and helps make well-being a shared priority, not just a program. Next is the employee voice. We've seen how valuable it is to engage staff directly in identifying needs and shaping solutions. It helps ensure our efforts are meaningful, relevant, and equitable, and it builds trust. Then addressing structural barriers. This means taking a closer look at the systems and policies that can either help or hinder well-being. Things like flexible scheduling, access to childcare or fair wages. Removing barriers like these creates the conditions for people to truly thrive. Cross-sector partnerships also are key. Working with campus and community partners helps us reach people more effectively and fills gaps in social support that can't address alone. And finally, sustained investment. Culture change doesn't happen in a year or even 2. It takes consistent investment, time, resources, and attention to see lasting change and measurable outcomes. And now I'm going to hand it back over to Bree.
Hello again. I want to close us out of this portion of the panel by sharing this quote from one of our resource coach participants. You listened to me and treated me with empathy. You made me feel human and valued. Overall, that is really the heart of this work. The Social Determinants of Health Initiative and the Resource Coach Program are not just about meeting needs. They're about honoring the humanity of our colleagues, creating systems that respond with care, and designing a workplace where well-being is shared, not earned. When we invest in collective well-being through intentional, human-centered program design, every referral, every conversation, and every coach interaction is one more step towards a culture where all of our employees can thrive. That's the vision we're carrying forward, a University of Michigan where thriving is possible for all. Thank you.
Well, thank you all for a terrific presentation. Um, why don't we open it up for questions and comments, and I'll start the conversation if that's okay. So, first of all, very, very impressive and deserving of the Health Project Sievert Koop Innovation Award. Amazing program. And what I find refreshing here is that it really follows the social ecological model of health, which says that you start with the individual, you move to the family, you then move into the organization in which that person and persons spend a lot of time, and ultimately in the community. And it really has deviated markedly in a good way from the very traditional ways of doing health promotion, which is you have a risk factor, we need to remedy that risk factor, and we're going to get you up and healthy. And oh, you've got financial problems, well, we can't talk about that. You've got family problems, no. You've got work problems, no. You live in an unsafe community, no. You can't get food. So this really does expand the view of holistic health in the way that it should in the public health model. What's interesting, and I've been attending the American Public Health Association meeting here in Washington this week, is that when people think about public health, it is kind of this anonymous, nameless, something going on in the community. We're not quite sure, but we need to work our way backwards as well, not just outward, but take the community, bring it back to the workplace, the organization, bring it back to the family, and bring it back to the individual and how that individual benefits from public health initiatives. And I think you've done a remarkable job making that connection. So let me ask, this is hard to do, right? It requires a lot of effort, thinking, planning, coordination, and all that. And is it an individual who kind of set things in motion and whispered in the ear of the president of the university saying, this is what we need to do? Or tell me a little bit about how it came about, what the backstory to this program is.
Bree or Allison, y'all want to take it, or you would like me to jump in?
I'd say Allison. I joined in January and I'm glad to be here. However, I'm the future.
I'm happy to talk a
Allison
little
has the history.
Yeah, I'm happy to talk a little bit about that. So, I'm the associate director for Healthy, and in my predecessor, in 2018, 2019, really started to think about how an employee's experience at work can be impacted by unmet basic needs. And so working with a small team of individuals came up with a proposal to submit to the leadership of the university, to the president specifically. And what started first was the resource coach program. That was kind of our first foray into an official program under the umbrella of social determinants of health. And we had our first resource coach start in the winter of 2019. Actually, no, 2019. And then COVID hit, and it was like, oh, what good timing we have, because there was so much need that then presented itself, and we had we had the program in place and the infrastructure set up to be able to support people. And so it was really, really great timing in terms of, what was happening in the world at the time. So, so it was a recognition that, we needed to support our employees in a way that was maybe not necessarily traditional, but that we found that there were gaps in people's lives that we could potentially fill. And so we had an awesome advocate and then also great supportive leadership across the university and within our own human resources to be able to get funding to be able to start the program.
Thank you, Allison. We're going to tag team Rebecca and I. She's going to be asking questions. She'll bounce it back to me. We'll do ping ponging on this. So, Rebecca, why don't you go ahead and ask your question?
Sure. Again, thank you, Karen, Allison, and Bree, for sharing an inspiring overview of your work at the University of Michigan. Your program truly reflects the spirit of the Health Projects Innovation Award, human-centered employee voice, where thriving is possible for all. Just to unpack that and think about how that not only impacts your population, but also the greater community. And thank you for, again, your leadership and sharing, because I do think there's such a key opportunity to share the lessons. So as we, again, have this question and answer period, one of the unique features of the Health Projects Innovation Award is its emphasis on early measurable results. And you've shared a lot, 308 employees engaged, significant referrals, mini grants, employee hardship awards, so much good work. As you think of all this good work, what are some of the most meaningful things that you believe have really impacted this population? So what is really near and dear, not only to the University of Michigan, but also your team and the work that you're doing to impact others? So anything that really goes up, bigger and broader. Bree, do you want to start?
Yeah, I can start with that. So I think overall, as was mentioned by Ron, is just this idea of looking at the whole employee. No one can be extracted from their environment or the factors that are impacting them. And so every time a resource coach interacts with an employee, there's a story there. We can take a look at the numbers over and over again. However, when you break it down, everyone has an individual experience that's bringing them to a place of potentially crisis or hardship. And I'd say collectively, that's what we hold near and dear, is that empathy and that compassion and that awareness that everyone has life struggles and that will likely impact them in all areas of life. And as an employer, we're able and fortunate to be able to provide the resources and the assistance that can make that at least a little bit better. In terms of the direct needs that we see, as mentioned, it's often things such as utility bills. Folks may be facing a utility shutoff. Folks may be at risk of losing their housing. Folks may have unreliable transportation to get to and from work. So all of those stressors that we're seeing that might make an employee feel as though, oh no, am I going to lose my job? Am I going to not be able to make it to work? Are something that we're able to not only reassure them that, we can help with that. And if we can't, we can definitely refer you to someone who potentially can, but also take away and relieve that sort of punitive model of employment where, if you can't make it, then that's a problem. Instead, we're there to support and make sure that folks can make it to work, not only in terms of the literal transportation, but with their well-being as intact as possible.
Yeah, thank you. And Karen or Allison, anything else you'd like to share?
Yeah, this is Karen. I'll just share, in addition to what Bree shared, as we think from historically, we really realized that in 2018 and 2019, there were groups that we were not serving, and we needed to do a better job. And so, in partnership with our research program manager, Dr. Christy Jenkins, we looked at the data to say, boy, who are we not engaging and why not? And what do we need to do better or differently? And that really helped us to make a shift. And so, we've seen, and even anecdotally, the one quote you shared, Bree, was just so powerful, but we continue to receive those quotes almost on a weekly, monthly basis of the impact and the power that our resource coach team has on the lives of our colleagues and our teammates across the university. And that is so powerful. And it's also translated into positive outcomes as well. But that human element is so important, and we needed to make a bit of a shift. about 7, 8 years ago to make sure that we were serving all of our population and not just those who maybe had the time or resources to engage.
Thank you. Ron, there's a question in the Q&A that I'd like to ask at this time, and then I'll transition it back to you. And then again, like you said, just let me know. I have a few more questions and I'm happy to ask our esteemed panelists. So a question, can you please describe more about the financial support mini grant emergency funds? How does it work? What amounts are available? And what is the application process? And how is it budgeted? So who, what, when, where, how? Like, it took some effort, I'm sure. So if Karen, do you want to start, or Allison?
You know, I actually think Bree might be better suited. So I'm gonna turn the virtual mic over to Bree.
As I toggle on and off of mute. All right. So we have two funding sources that can assist employees. As mentioned, we have mini grants and we have the emergency hardship fund. Mini grants are provided directly through our resource coach program with support from our internal leadership as needed. They address a critical financial situation. The maximum amount there is $500. Employees are eligible annually, so annually from the date that they apply. So if someone received a mini grant on January 1st, they might be eligible depending on eligibility factors, which I will discuss again on the following January 1st. There's no eligibility requirements regarding length of employment, how many hours a work week, how many hours you work a week, tongue twister. However, those are lower barrier. We need employees to be there, to be employed with the university, to not be facing disciplinary action, and to be in salary band 1, which currently is earning $55,600 annually or less. In terms of application for mini grants, folks go directly through our administrative team at mHealthy, our administrative assistant, who I believe is on the call right now, Diana. So she manages our intake line, and employees call, they explain their situation. She does a brief intake with them, and assuming that they are eligible for our services and or are wanting to connect with a resource coach if they may not be eligible for that financial assistance, then she schedules them with a coach. The coach does another longer assessment with the employee. And from there, they explore all options. And so while financial assistance is one of the options, it might not be the best choice at the time, even if folks are eligible. There might be other resources in the community. There might be other stones left unturned. So the resource coach is really doing a deep dive with that employee to figure out what is best there. Assuming a mini grant is going to be accessed, then those funds are approved internally. The employee signs an agreement form, and then the payment is issued directly to the vendor that we would be helping the employee with. So if they're looking for a car repair, it would be paid directly to the mechanic shop, and so on and so forth. After that, employees can take out, so it's not always $500. Let's say an employee has a utility bill of $200, they can utilize, and they're approved for funding, they can utilize that funding there, and then come back a couple months later, they have another situation going on, they need a car repair, that's $300, they can combine funds in that way. In terms of in terms of how it's funded, we're able to accept donations. So some folks donate directly through payroll. It comes out of their paycheck every month. We're very grateful for that. And we also have funds allocated directly through our university leadership that are earmarked by fiscal year. And so, annually we are re-upping these funds. We're doing projections. We're analyzing, what have we seen? What are we looking for in the future? And continuing to make progress and to provide assistance in that way with mini grants. In terms of emergency hardship funds, those are primarily donation-based. They rest in different accounts and endowments, so on and so forth. Those are triggered by what we call a qualifying event or a catastrophic event. And so that looks more like someone experienced, a tree falling on their car or something very unpredictable, fire or flood damage, serious illness or critical injury that made it so that someone could not work a sudden loss of income that was unexpected somehow. And the eligible expenses there are similar to the mini grants. So utility assistance potentially, home repairs, car repairs due to catastrophic events. Those funds are a bit larger. Employees are able to access a range of $1,000 to about $1,500 depending on the event. Funds are associated differently with different events. From there, employees would go through, if the resource coach determines with them that that's the best course of action, they would complete an application with the resource coach. They would also complete a budgeting sort of worksheet and snapshot to show sustainability. You know, this is a one-time event. This came out of left field, and here's how my finances will be sustained moving forward. From there, the application is submitted to our EHP review board, which is the collective of professionals across the university. We've got professors, we've got folks from business and finance. It's anonymized, redacted. They review the application. We currently have 9 members of that board who review applications and provide very quick, which I'm very grateful for, responses within 24 hours stating whether or not they approve the funds, if they decline the funds, or if they have further questions about the application itself, which our resource coach or myself can then provide more insight to. And then a decision is made at that point based on majority vote within that panel. I'm not sure if I hit every point for each funding, but there's a mouthful of a snapshot.
That was excellent. And thank you so much for providing that measure of detail as well. Ron, I'll transition to you if you have a question.
Yeah, this is very impressive, and that was my main question there in terms of funding and resources. And you know, I'm at a university, Johns Hopkins, which has been stressed to the ultimate in terms of government cutbacks on funding. We lost roughly $1 billion because of USAID being dismantled. So a lot of resources, a lot of research stopped. And the university is taking a very conservative point of view, which is saying, you know, we're not hiring any more people, PhD students, we're limiting those. A lot of the things that you normally would have done, we're not doing anymore. So are you feeling some of that pressure at the University of Michigan that this may be a program that's, you know, nice, but, you know, it's above and beyond what we can afford?
Ron, it's Karen. I'll take this one. And we are similar to you, Ron, that our university has taken a bit of a hit in terms of our overall budget. And this past February and March, we actually started as a unit through rolling up to human resources to implement cost containment measures. And so we pulled back on a number of our events and activities and strategies, all while being very mindful, though, that we want to continue to support individuals who may need it the most. And so we did pause, and we had to pause doing a lot, which caused, you know, some disappointment with our community, with our own internal staff. We had to pause things like our wellness champion gathering. We had to pause our wellness champion grants. We paused our big event that we do in the Michigan football stadium. And we had to pull back. And it was, at the time, it was the right thing to do because we wanted to keep our resources intact, in particular for the Social Determinants of Health initiative. We continue to work with leadership to explore what's possible. And so we're in conversation as recently with my boss about a week ago to continue to explore what's possible. We are really trying to be very mindful of not impacting the dollars for this program because at this time in our world, it is so much in demand. Bree and Allison and I and others have had recent conversations about the impact of the changes to the SNAP program and what that's going to mean as we think about food security and our population. And so we're continuing to explore what's possible. But it is a very tricky balance, and there are things that we've had to pull back on. But the Social Determinants of Health program is one where we're really trying to commit to not have to touch those dollars.
It's great. I'll ask one follow-up and then turn it over back to you, Rebecca. What about coordination with community, local public health services or other human resources services that may be available, social services? How do you manage that?
I can speak to that. So, as one of our strategic goals for the program for 2026 and in the past, prior to when I was with this program, it is about expanding our partnerships in community. So, myself, prior to coming into this role, I spent 5 years doing supportive housing justice work at a local nonprofit. Within that, I made a lot of nonprofit connections. We also employ two of the resource coaches are social workers, and so they have a lot of experience in that realm as well. And so, just as we're looking to support the collective whole in the community of wage one or wage man one earning employees, we know that we can't do that without the broader community. And within Washtenaw County, Wayne County, surrounding counties in Michigan, we are fortunate to have a ton of resources. And we're looking, even just yesterday, we built a connection and had a meeting with the financial empowerment program through our county's Office of Community and Economic Development. And so we're learning about what they do. They'll be doing a mini talk webinar with us in March. And we're also, I need to send that email if the resource coaches are listening. But we will also be connecting directly with their program manager to talk about how we can collaborate, as our work is very similar. And as they are funded and structured within the county government, their funding is also stable. Fortunately, ours are as well. And so we can both be thought partners in how to approach this and also referral partners. We have employees that go to the center. I'm sure there are employees at the University of Michigan that go to the Financial Empowerment Center that may not be aware of the resources available within their own workplace. And so we're consistently looking to build those connections in that community. And I'm fortunate to have a team of 3 resource coaches that are we're constantly sending emails. There's a holiday food program drive through here. We just talked about that this morning. And so, while also having our internal partnerships intact and continuing to nurture those, we always have an eye on what else is out there and what else is available.
Sounds great, Rebecca.
Yeah, exactly. No, I love all of that. So one of the resources that other employers in the past have shared is Aunt Bertha, which has now been rebranded as Find Help, sorry. It's a reliable, widely used platform for identifying and referring people to resources addressing social determinants of health. And I know that many joining us today are trying to figure out, if we don't have something like this wonderful, rich resource that you all have really built and designed, what are some of those other like platforms or partners? So in addition to perhaps Find Help, have you found some additional resources? Again, kind of thinking from the lens of other employers and what they could share or how they could start building some resources.
I'd say, in addition to Find Help, 211.org is fantastic. I believe it is national, typically connected through the United Way of any given state or county. I would also say, sometimes you have to get pretty specific, but a broad Google search. And so, especially with food security right now, we've been consistently running searches on food access in blank county, food access due to SNAP benefit pause or shutdown. I think it's kind of, again, toggling back and forth on what's happening there. So I would start there. I would also say, in any given location, looking at the county level resources on the government web pages and/or the city level resources, those are typically available there. Nationally, different states and counties are required to have certain services available, even if it is through the Department of Health and Human Services. And so starting at that web page typically links you to a slew of other resources. And they often have resource lists available for download. I know 211, you can search directly and it'll give you a personalized list of what you're looking for, though. That's one that we use regularly.
Thank you so much. I have one more question, and then Ron, I'll turn it back to you. So in your presentation, you mentioned several key ingredients for success: leadership buy-in, the employee voice, addressing structural barriers, cross-sector partnerships, and sustained investment. Which of these factors do you believe will be the most critical for sustaining progress and scaling your efforts over time?
This is Karen, y'all. I will chime in here. I think the sustained investment, I think, is key. Ron, as you had mentioned, there are changes that are impacting all of our universities. So I think that's one piece that's key. And for us, the ability to continue to share the business case and the rationale of why it's important to continue moving forward with initiatives like this. So I think the sustained investment is key, and also the leadership buy-in. Like many other organizations and universities, we've had some transition recently with our president and our CFO. And so we will be getting a new president and a new CFO within the coming months. And so with that, there's always a question mark, right? There's always the unknown. And so we continue to work with Dr. Jenkins, Christy Jenkins, to build our data repository to be able to tell the story of the impact that this is having. I think over the last few years, y'all, since we started the Social Determinants of Health program, I think we might be on our fourth president here, or going on our fourth president here at the university. And so there has been, a lots of change, but we continue to communicate the value that we're bringing with this program, as well as across Healthy, to our leadership, whether that is through informal conversations, whether that is pulling together unit level reports that we're able to share with specific units, and having those conversations with leadership. I'm going to look at my Allison Square and see if she would share anything in addition.
Yeah, I think that one of the things while you were talking, Karen, I was thinking about is just the competing priorities that we have at the university. And with changes in leadership, those priorities change also. So not only are the priorities changing, but they change within those systems. And so making sure we stay present and out there and relevant and continuing to use our data to tell a story about the work that we do and the impacts that we have are critical in terms of our leadership. We have to stay out in front of them so that they see what we're doing and just because of all the competition of all of the especially right now with everything going on in the world. And so I think it's just the leadership buy-in and staying relevant is critical for us moving forward.
Yeah, let me. There's a note that just came in from Jesse Gavin, who's at the Baylor College of Medicine, saying that thanks for sharing all of this great information. Hearing all of you, they're going to be adding a donation to the student pantry and the employee emergency fund as an incentive option for next year. So these ideas are being replicated across universities and hopefully beyond universities. One final note, you've been a recipient of the C. Everett Koop Award several times in different ways, and one of the distinguishing factors and features of the University of Michigan is that you are really good at data analysis and presentation. You've got the experts in-house, you know how to gather the data, you know how to integrate data and present the data. So the requirements for winning the Koop Award, and to a large extent for the Innovation Award, is you've got to prove, you've got to show with data that you've improved population health and also had a business impact. And I'm wondering how much of that has been able to be sustained your program over time, that you are able to share data on an ongoing basis, showing this is not just a good thing to do, but also has a financial impact, a positive financial impact on our operation.
Yeah, Ron, it's Karen. I'll take that one. And it's been critical for us to have that data repository. And frankly, when we do apply and have applied in the past for the Koop Award, it is amazing because we get feedback from the reviewers of the application that tell us, hey, y'all, you're doing well in this area, but maybe you should think about these other data points. And that has been so instrumental in helping us to ensure that we are collecting the right data and then sharing that out with appropriate leaders. And so for us, it is critically important that we are able to show the value on the investment that leadership is making in order for them to continue that moving forward. And so it's just critically important. And I will say the impact, the input that we get from whether it's applying for the award, whether it was the innovation award, we took the feedback that we got from the innovation award application and have already built in, as Bree mentioned, some additional metrics and objectives and key results moving forward based on that. So, and we are very fortunate that we do have a research small but mighty team that is able to help us pull this information together, and that we have a really strong relationship and partnership with our benefits office so that we can marry some of our data with that which is in the third-party data warehouse of Meritive as we look at different claims from the benefits office.
Terrific. Just saw a question from Philip Swayze saying, such a needed and thoughtful program if you consider deeper connection with a community like Blue Zones or Wellville.
You know, it's something, and hey, Philip, thank you for the question. We've looked at Blue Zones years ago, but really did not do a deeper dive at this point in it. And one of the things that we're always mindful of is that our funding structure, our funding structure is specifically for faculty and staff. And so as we think about how we interact in the community and how we engage, we continue to make sure that we have strong partnerships across the state of Michigan, in our communities, in our counties. And also, we're careful in that when we are working with communities, our funding and our resources are limited to what extent we can do. And so, but it is, Philip, it's something that we might dust off again as we think about the Blue Zone style, and something to, as we move into FY26 and beyond, that we can continue to explore further.
Just as an aside, we're working with the Ardmore Institute of Health to examine Blue Zones and Wellville communities and see how well they've fared over the last decade, comparison to other communities. So there'll be more information coming out on that project. I think we've addressed all the questions that are out there. Really, really appreciate your contribution. Very thoughtful approach, and I commend you for being thoughtful, diligent, resourceful, and very hopeful in many ways of the things that you're doing, and setting an example, being a model for other organizations, and hopefully beyond universities, and moving into the business world as well to show them how this can be done, to go beyond what you're doing in the workplace into the community and helping people day-to-day lives, which right now is very much needed with all the cutbacks in social services. So thank you so much for your work, for sharing your work, for applying for the COOP Award and the Innovation Award, and all the very best to you in the future. And with that, we'll close our session today. Thank you all for participating.
Thank you all.
Thank you.